tertiary lymph node in the brain where these growing lesions are. And as you can see, they are palisaded by these microglia cells, which you see in the susceptibility imaging as a dark rim, and that constitutes microglia, and the microglia is chewing into the adjacent healthy tissue in the brain. So now, if you look at the uptake of the PET scan, which I showed you before, in healthy controls versus MS patients, in the whole brain, on the left-hand side, or the same thing in healthy controls in MS patients, in normal appearing white matter, you see a difference. So you see a difference that there's a diffuse increase of microglial activity, even in the normal appearing white matter. Why is that? Well, it's because a 3 Tesla MRI is not a 7 Tesla MRI. If you use the 7 Tesla MRI, you will see more. But it tells you that the MRI only shows you the tip of the iceberg, and there's still a lot to discover under. This is what I was going to show you before. The slides somehow got mixed up. So Walensky and his group, looking at these scans of the growing lesions, they found and overlaid it with the PET scans. They found growing lesions in the normal appearing white matter and in the white matter where the lesions were. So in red is those lesions that you could see on an MRI scan that were growing over time, and they were marked with the activated PET marker, so with microglial activity, and in green is in those areas of the brain where you didn't see anything wrong on the MRI in the first place. So it tells you that by using this technology, you can actually dive into an MS brain and see much, much more than the eye shows you on a regular MRI scan. Which tells me that if you look at, I didn't include this in my talk, but if you look at the new 7 Tesla MRIs that are being done in MS patients, you can see there are little tiny cortical areas all over the place that certainly don't show on a 3 Tesla, 1.5 Tesla scan, and they don't enhance necessarily, because these lesions don't enhance. It's a non-vascular process that does not enhance gadolinium. So this is clear that the further or more advanced imaging techniques such as those, I'm not saying that they should be used in clinical practice, but they're telling us about the disease process and how we need to understand what's happening to our real MS patients and what it is. And this is why I think what Dr. Pitcock said yesterday is so clear. MS, we don't really know exactly. Is it all immunology, or is it both, or is it something that happens at the same time? And this is what most people think now, that it is two parallel disease processes. One is the smoldering or Pyrrha-generating degeneration that starts basically at the same time when you have the firework of immunologically induced relapsing, remitting events. So now, the last thing is